Okay, I think we'll get started. So, hello, welcome everyone, and thanks for taking the time out today to join us. My name's Peter McCartney. I'm the owner of Whiteley All Care. We've actually got over 165 registrations for this webinar, which is probably no surprise given the hot topic, and people are still sort of rolling in at the moment. So it's will probably take a little while for us to get up to the full numbers. We will be recording the webinar, so if you actually need to step away for any reason, or if you want to actually share it with someone afterwards, just it'll be available after we finish. We'll get started straight away with a presentation from Ibrahim Samal. We just call him Ibi. We will then get into a Q&A after Ibi's presentation, and we expect to be wrapped up within 30 minutes, so we won't keep everyone too long. We've also got joining us on the panel here, Marie. Marie's moderating the webinar and any Q&A that will follow. So I'll pass straight over to Ibi. Ibi's joining us from Australia. He's an Australian physiotherapist and he's the founder of Purifas. So over to you, Ibi.
Good afternoon. Thank you, Peter, for that introduction. My name is Ibrahim and I am the CEO and founder of Purifas. I'd first like to thank you all for taking time out of your day to join me on this hygiene webinar. Before I give you a brief background on myself, I'd like to also thank Whiteley All Care for hosting this event and strongly supporting our mission to reduce healthcare acquired infections. So like you guys, I am an allied health practitioner. I worked as a physiotherapist for 12 years in both the public and private sector. And in that time, I ended up settling down in the musculoskeletal sector, specializing in manual therapy. And in that time, I noticed a few things. So number one, whether you're a chiro, physio, osteo, massage therapist, we are the specialists in our field. So much so that on occasion we may disagree with the recommendations from the treating practitioner. Number two, when you compare our industries to the industries of medical, dental and pharmaceutical, our funding is significantly a lot less. And as a result, we don't have as much guidance and support, especially when we're trying to improve and progress as an industry. So in saying that, the gap in our industry that we'll be focusing on today is the, let's face it, quite boring, but as health professionals, very essential topic of the infection risks during therapy. With hygiene awareness at its greatest in our customers, thanks to all the media attention of COVID-19, good hygiene practice and infection control has never been more important to practice. So we'll be covering a few topics today that I'd like to go through with you. Number one, to give you a background on how infections are transmitted. Number two, all the current research that exists and how to apply that research in our industries. We've also established some best practice guidelines that should be used in a therapy clinic based on this current research. And then we're going to introduce you to some of the new Purifas products that have the main aim of reducing healthcare acquired infections. So let's start with how infections are transmitted. There are currently three modes of transmission: contact, droplet, and airborne. So contact, as the term suggests, is the transmission of pathogens through touch. So this can be direct, where the infection agent is transmitted directly from person to person, or it can be indirect, so where a pathogen is transferred through an intermediary object. So for example, if you cough on a table and someone else touches that table and then places it on their eye, that's how the pathogen will transfer. Contact is the most common form of transmission. The next mode of transmission is droplet. So this is where respiratory droplets are expelled through either coughing, sneezing, breathing, talking. Like contact, this can also transfer through directly or indirectly, depending on where the droplet lands. And the third form is airborne. So airborne happens similar to droplet through talking, breathing, coughing, sneezing. The difference with the airborne is that as the droplet is expelled, it evaporates and the pathogen lingers in the air environment around you. You'll often get air currents that push these pathogens to different areas. And the way this would infect the person is they would usually inhale that pathogen. So it would be safe to say that most airborne transmitted diseases can also be transmitted through the contact and droplet form. However, not all contact and droplet transmitted diseases are also airborne. So let's apply these principles to the tools of our trade, more specifically our therapy bed. So if we use our imagination for a second here, and we take this as the face hole of our therapy bed and we extend out the bed, which modes would most commonly apply in our industry? Number one, clear as day, contact. We all have our patients and clientele lying on the bed. So because of that contact, they will always leave remnants of their microbes behind. And again, if we focus specifically on the face hole, not only will this be exposed to the contact mode of transmission, but also when their face is in the hole, if they're breathing, talking, sneezing, if you push too hard, salivating, this all ends up on the interior aspect of the therapy bed. So I would say that this is this area would be a significant risk, not only because it's contact and droplet, exposed to contact and droplet forms of transmission, but also because the eyes, nose, and mouth are the most common points of entry for a pathogen, and they're in very close to this area of the bed. How do we know that this is a infection risk? We tested it. So we went through to 5 random clinics and we swabbed the internal aspect of the therapy bed, and the results were quite astounding actually. So 1 out of 5 of those beds showed rhinovirus, which is your common cold virus. We had 2 out of 5 which showed golden staph, one of which was antibiotic resistant. This came as no surprise because most people are actually carriers of staph on their face, on their skin, and in their nose. Staph is also one of the biggest reasons for healthcare acquired infections. And all 5 bed showed skin cells and skin flora. So we didn't actually find any one out of the 5 which didn't have any microbes on it. And although skin cells and skin flora are non-harmful, I don't know how many of your patients would feel comfortable rubbing their face against someone else's as they're leaving your clinic. So this is part of our research. We'll go through the rest of our research a bit later on. But what research currently exists? Let's start with hand washing. All the research and all the resources for all the studies I'm about to mention, they're all on our website. So with hand washing, I think you guys would be astounded to know that 40% of healthcare acquired infections can be attributed to the hands of healthcare workers. Why is this? If everyone's washing their hands, that's generally not the case. So there was a study done in a teaching hospital to measure the compliance rate of hand washing amongst health professionals. When they were supervised, that compliance rate was up at 94%. And when they were unsupervised, well, down to 30%, believe it or not. There was another study that was done which measured the compliance of not only the practitioners, but also the attendees. And this reported hand washing compliance down as low as 10%. In terms of cleaning and sanitizing, we've all seen that 99.9% antibacterial wipe or spray. Unfortunately, in reality, that's not always the case. So there was a study that was done which focused on MRSA carrying patients and their therapy and their treatment rooms. So after 4 rounds of cleaning using a hospital-grade bleach disinfectant, that's 4 rounds, there were 23% that were still contaminated with MRSA after 4 rounds. There's actually another study which reinforced this, which focused on the patient using the room after someone was confirmed with a multi-drug resistant organism. So the second patient was shown to be at significantly higher risk of acquiring that same multi-drug resistant organism as the patient before, despite terminal cleaning. It was shown, however, that the best cleaning agent are those that do have 70% of alcohol or more, and also showed that it was an effective agent to clean up to 80% of contaminated surfaces. Single-use products. So single-use products and hygiene are known to go hand in hand, and there's a reason for it. So there have been a number of studies on reusable materials, things like your towels, your bed linen, your pillowcases, and these were shown that they could actually harbour harmful pathogens for up to weeks despite regular cleaning. There was one study which showed MRSA, which is your staph, lasting on a fabric for up to 9 weeks. This is the main reason why you're seeing all the hospitals move towards single-use hygiene products where possible. So we applied this research to our current practice in our industries. Things like your current paper-based head sheets, the ones that only cover the top, because of the contact mode of transmission, this can obviously keep an infection risk and their efficacy can be questioned. Things like using towels. Obviously in our field, it's quite difficult to remove towels. And for those cases, there's an informative blog on our website about the correct cleaning process. However, situations that can be avoided in using towels, things like in your bathroom, instead of giving your customers a towel, give them some paper towels, or the very common terry toweling bed cover should no longer be used. And the other thing is currently using those chemicals that report 99.9%. Based on the research, it's shown that they're in real world practice, they don't often work as well. So based on all this research, we've actually developed some 5 key steps that we recommend you apply in your field and in your clinics. The first one, very simply, we've taken a note out of the book of Jacinta Arden here. If your patient is experiencing any symptoms, stay at home. The safest way to keep your clinic clear of pathogens is to ensure that the people carrying those pathogens do not attend. There are a few ways that we recommend you can do this. You can have a hygiene section on your website. If you confirm appointments with your attendees, then make sure you ask them if they're experiencing any symptoms to reschedule through social media posts, having signs up in your waiting room, letting people know that this is a policy of your clinic. Not only does the therapist need to wash their hands, but we highly recommend that the client washes their hands upon entry into the clinic and after their treatment. Therapist, we recommend, goes that step further and washes his or her hands before treatment and also after having any environmental contact, computer screen, things like keyboard, things like that. We highly recommend the sanitation of all shared surfaces, in particular the therapy bed, as this is directly shared with every patient that comes through. And not only that, but also all your high traffic areas should be wiped down regularly. So on this note, there was a study that was done in a hospital where they allocated a specific staff member whose task was only to keep the high traffic areas cleaned and sanitized. And this actually had a direct relation to healthcare acquired, to the number of healthcare acquired infections. Number 5 is single-use products. This is across the board. So like I mentioned earlier, things like instead of giving your customers towels to use in your bathroom, giving them a paper product, thinking about a covering for the whole bed. And then another thing would be if you were to focus on the face hole of a therapy bed, this is where our company would come into it. So we recommend using something that we've termed a face shield for all face down therapies. And this is a protective covering that not only protects the top plate, but also has this internal skirt to protect against not only the contact, but also the droplet transmission. How do we know this thing works? We had it tested. So we manufactured this product from a similar fabric to a surgical mask. And we wanted to ensure that we test it against an international standard so that we can see how we measure up. The only international standard for bacterial filtration efficiency is the test that they use on surgical masks. So what they do in this test is they actually spray 28.3 liters per minute of staph through the fabric, and they measure how much comes out on the other side. The reason they spray that 28.3 liters per minute is because this is the average amount of air a person would exhale per minute, because that is the amount of force that would go through a surgical mask. Obviously, with our product, we leave the air open, so you only get the external expired air on the product. So on this international test, we scored 40%. However, when we retested and put our product under the same pressures that it would experience in a real life clinic, this came back at 86%. As mentioned earlier, your lab testing results and your real life results are often quite different. So we then ran a clinical trial. In this clinical trial, we had 2 groups of 5 people. All these people had neck pain, and they were all treated by the same practitioner. First group was treated without the face shield, and the second group was treated with the face shield. There was a very stringent 3-stage cleaning process beforehand, and we took a swab of the bed beforehand to ensure that there were no microbes left. And then we also took a swab after the 5 patients were treated. And as you can see there on your screen, our test results came back closer to the 86% than it did the 40. Not only is it a superior hygiene product, there are also a number of other benefits to the product. On the note of hygiene, we ensured that the product is both saliva and sweat resistant, as these are often vessels for pathogens to travel through. It's manufactured in 2-ply to add comfort, and it is 100% recyclable through any of your soft recycling programs. It's also, because it's a polypropylene, it also doesn't stick or absorb moisture, so quite comfortable for the patient. How do we know it's comfortable? Simple. We asked our customers. So we did some market research, which involved 90 people. All 90 people received treatment. First half of the treatment, they used the existing paper products, with the second half of their treatment using our face shield. And at the end of the service, they had a survey to complete. From that survey, surprising to say that 57% of people actually said that they're willing to change their practitioner who they've been seeing for 2 years for someone who uses a hygienic product like the face shield. And some of them had hygiene so close to hygiene was important to 65% of people that they were actually willing to pay 50 cents or more for the product. Some other surprising features was that they mentioned that there was no noise when compared to the paper product, and obviously improved comfort. On the note of comfort, I've already introduced you to our FacePad. This is also one of our other products, manufactured from a high density memory foam. However, in keeping with hygiene, it's one of the few on the market that has a full removable cover, and you can buy the covers separately to ensure that you've always got one clean and ready to go. So what messages do we want you to take away from today? Number 1, the infection risk in the therapy room is real. It exists. We deal very closely with patients and with people, and our current practices are not sufficient enough to reduce the risk of the risk of infection in our industry. We also wanted to introduce you to let you know that there are now fit-for-purpose products specific to your industry, specific to our industry. So we humbly ask that you join our mission to reduce healthcare-acquired infections and do your community a service by applying these 5 steps in your clinic. I mean, should your company benefit by being recognized as an industry leader by following these hygiene protocols, then I guess that's just the added benefit. Thank you.
Great, thanks for that, Ibby. We've got a couple of questions come through. If anyone's got any questions, they can just type it into the bottom of their webinar screen. There's a Q&A section there, so you can just type any of your questions in there. Marie, do you want to go through what we have so far for Ibby to answer?
Sure. Ibby, we've got a question from Dion, and the question is, as a chiropractor, our tables aren't holes, they are slits. Is using paper rolls sufficient?
So I'm assuming you're talking about the chiro rolls that come over the top of the bed. So there are a couple of products. We haven't officially had those products tested. It all depends on whether the products that are used can be termed paper products, although in most cases they are polypropylene. If they are polypropylene, the likelihood of this product having bacterial filtration properties is higher. If it is a paper product, I doubt that it would have any bacterial filtration properties, which would then put the next patient at risk. I hope that answers that question.
Okay, the next question is from Anne. Can the face shields be used for an ordinary massage bed with a face hole?
Sorry, I missed the start of that, Marie.
Sorry. Can the face shields be used for an ordinary massage bed with a hole?
Yeah, so the face shield was developed to be used for all massage beds. So you have the therapy beds where the face hole is in the middle, but you also have the therapy beds where there's an attachment that goes on the top with a little cradle cushion. It has been developed to be used for that as well. I would suggest speaking to Whiteley about getting some samples if you want to think about testing the product before you look to applying it long term.
Do you have a similar cover that would go over the entire bed instead of the paper rolls?
Good question. Developing new products is a long and arduous process. We are in the process of developing such a product, but as you can see from our face shield, we do extensive research and testing to ensure that it is a suitable enough product, especially being in the medical hygiene sector. So we are working on it, but please be patient with us. These things can take some time.
And maybe a question for Peter and Ibby, actually. Peter, given you probably have a few of these that you sell, and I just remind you, Peter, that you are on mute. So what do you both suggest goes over a PVC table cover, as the cover is uncomfortable for clients?
Yeah, at the moment it's a paper, would recommend paper. And that's obviously waiting until sort of Ibby's new product comes through, which would be a lot softer and sort of more comfortable than a paper product.
Perfect. Thank you.
From my point of view, I think the idea here would be focus on the idea of more single use than your existing terry toweling cover would be the more hygienic option. So although the bacterial filtration of paper may not be great, it's still better than having nothing. It's more like an added insurance policy, so to speak.
All right, I think, is that it now, Marie?
I'm just conscious of time. We've got a couple more minutes and a few questions have just come in, if that's okay.
Sure, yep.
So some of them are repetitive. I'll ask this one. Regarding step 3 in the 5-step process, what is the best cleaning solution? Is Virolux sufficient?
So I'm unsure what Virolux is, or what the chemical makeup is. There is a fairly informative blog about cleaning versus disinfecting on our website. Although in saying that, based on the research that we found, those products that had 70% of alcohol or more showed to be a more effective cleaner, and they actually cleaned up to about 80% of contaminated surfaces. In terms of your therapy bed and the vinyl or whatever fabric it's made of, you just need to ensure that alcohol won't shorten the lifespan of that therapy bed.
And that is probably one of our most contentious issues that we have is the recommended cleaners can be damaging to the vinyl, which is why we recommend a single-use product. We might finish there now, Ibby and Marie. So just letting everyone know, everyone who's sort of attended will actually be sending an email straight after this webinar. We've got these boxes of sample packs, 10 of the Purifas head shields within the box. So there'll just be some instructions on the email of how to actually get those delivered to you. So if we missed any questions, we'll actually put those on the bottom of the email as well as a link to where we've got this recording for the webinar. So I just want to thank everyone for their time again, and yeah, all the best.
Thank you. Thanks, everyone.